Welcome to AmeenAcademy.com. In abnormal psychology, let us discuss about dissociative stress disorder, DID, and multiple personality, some case studies. The complex and puzzling nature of dissociative identity disorder, DID, is illustrated in the controversy surrounding its name. It was formerly known as multiple personality disorder because most description of the syndrome have emphasized the diagnostic importance of several altered personalities. One unfortunate consequence of this approach has been a tendency towards public sensationalism and a preoccupation with counting the exact number of alters exhibited by any patient. These estimate how occasionally reached perspectivous numbers, with some clinicians claiming to see patients with have hundreds of personalities. Dissociative identity disorder is a rare phenomenon. Prior to 1980, fewer than 200 or 300 cases has been reported in the professional literature. It has attracted considerably attention partly because a few dramatic cases have received widespread publicity through popular book and films. Now let us discuss further detail about dissociative stress disorder and multiple personality, some case studies. Dissociative identity disorder, formerly known as multiple personality disorder, is a mental health condition where a person experiences two or more distinct identities or personality states called alters. These identities These identities control behavior at different times, along with gaps in memory, especially a traumatic events, did results from severe overwhelming childhood trauma, serving as a coping mechanisms to disconnect from intense distress. Treatment involves long-term psychotherapy to integrate these fragmented identities into a unified sense of self. Now, distinct identities. The present the presence of two or more separate personality states with distinct behaviors, memories, and thought pattern. Memory gives inability to recall important information, everyday events, and traumatic experiences that goes beyond ordinary forgetfulness. Changes in behavior and self-perception. Sudden shift in attitude, preferences, and behavior, or a sense of one's body feeling different and not belonging to them. Internal voices. Experiencing voices that are internal conversations between identities or many comment on the person's behavior. Distress and impairment. Symptoms that cause significant distress or problem in social, occupational, or other important areas of functioning. Some causes. The overwhelming consensus is that did develops as a result of severe, prolonged, and overwhelming childhood trauma such as severe abuse. Dissociations is a protective psychological coping mechanism where the mind creates detachment from intense pain, allowing the individual to evade the immediate experience of the trauma. Triggers. Various triggers can cause someone with DID to switch between their alters or identity states. These can include stress, strong emotions, memories, senses, alcohol and substance use, specific situation or events. Some treatment. The primary treatment for DID is long term psychotherapy. The goal of this therapy is to help the individuals manage dissociations, address and manage dissociative symptoms to establish a degree of internal safety and stability, integrate identities, deconstruct the distinct personalities and integrate them into a single cohesive sense of self, process trauma, processes the underlying traumatic experiences that led to the development of dead medications. There are while there are no medications to treat DID itself, antidepressants, anti-anxiety medications, or other drugs may be prescribed to help manage associated symptoms like depression or anxiety. So far, we discussed a little about dissociative stress disorder, that is DID, and multiple personalities. We have done. Please subscribe our YouTube channel.